Welcome again to the Race Academy webinar series. Episode number 30. Where have they all gone? Wow, number 30 already. Today we're talking about splints, in particular dental splints. Which splint to recommend for your patients, when and why. But before we get started, I'd like to give everyone a last minute to come on board. We have an enormous amount of registrants today, well over, I believe, well over the 100 mark. With people from Australia, New Zealand, Malaysia. G'day to everyone in Malaysia, our friends in Singapore and Scotland today. Wonderful to see we've got so many people from all around the globe joining us today for which splints to recommend for your patients, when and why. As usual, I will ask all questions to be held until the end. Feel free to click the bottom down below and put your questions in there, and I'll do my best to answer those at the end of the webinar. So again, welcome to everyone who is with us today, and we're going to get started. I will just look to 1 second. Share this screen with you to get started. All right, as I mentioned, which splints to use for your patients, when and why. For all of you that don't know, Race Dental are a full-service dental laboratory doing crown and bridge, acrylic, chrome, orthodontics, implants, general implants, all on X, orthognathic services, digital impressions, technical support, and splints. And today we're going to be focusing on splints. So, which splints to choose for your patients, when and why? We're going to be talking about all types of splints, from comfort to high impact, anterior clenching splints. There are some other GURBs, then orthognathics and sleep apnea appliances, deprogrammers, a whole bunch of different splints. But let's get started and talk about what the lab needs to give you and your patients everything they need. So first, we're going to start off with the impressions. Obviously, we do accept both traditional impressions and digital impressions. If there is we do prefer a digital impression, of course, but feel free, if you don't have a digital impression system, to take a standard impression. If the patient does have braces, they can be blocked out prior to a traditional impression being taken. But if you have a digital impression system and the patient is wearing braces, feel free just to take the scan. We will deal with that at this end. Ensure that you do encapsulate all of the tuberosity area and you do incorporate the palate. For the splints, we do require a lot of the palate. So for digital impressions, ensure you engage more than the teeth. For lower splints required, please incorporate the retromolar pad as well. So the impression is paramount to the success of the splint. No missing data, no drags in proximal labially. And obviously we do require the bite, so please do provide the correct maxillary mandibular relationship to ensure that your splint is processed correctly. If the patient is wearing dentures or an appliance or retainers, they can be left in situ during the impression process. Obviously, if there's a full arch or a larger impression or denture down here, it's important that that's left in. If the patient's wearing an appliance, they can be left in or removed. That's totally up to you. I do recommend, if it is an appliance, that it is left in for the impression technique. And if the patient is currently in aligners, obviously if it's an aligner that's any aligner prior to the final aligner, take it out, because that will need to be changed and the splint won't fit once they use the second, third or fourth aligner. So if it is the retainer or the last aligner, it can be left in place for the impression process for any splint manufacturer. So that is important. If it is a retainer, that's fine. But if it is an aligner and it's not the last one, please remember to remove that, or the splint will only fit during the that aligner or maybe the next one only. So keep those in mind. Any appliances left in situ outside of any retainer prior to the last. Once the impression has been taken, send any traditional impressions. You can go onto Race website, racedental.com.au, and click order a pickup, and our customer support team will engage the courier to come and pick up those traditional impressions. Alternatively, for most of you who have digital impression systems, send them through the connection portals, or feel free to use the Race Dental portal. For any information or anyone that doesn't understand or know how to use the Race portal, please contact us here at Race Dental or customer support at racedental.com.au, and we will walk you through how to use the portal, the benefits of the fully compliant and secure Race Dental portal system, so you can send information through, lab cards through, and all your information digitally through our Race portal. So you can see the impression has been taken on the left. It comes through to the lab. It is digitally designed. We go through all the movements and design the appliance or the splint digitally. It then goes through to print, and I'm going to talk through the technical benefits of printing splints today. The print comes out, and the case is then finished, hand finished by our technicians here in Australia and our technicians in New Zealand. So a pretty simple workflow, but let's get into the do's and don'ts. We will be utilising the carbon system, and this is the, in my opinion, the world's best printer. Super accurate technology. I do love this photo of it because it does detail the 24-hour lights out capability we have to print, which decreases our turnaround times and increases our efficiencies. You see, this is what the platform of print looks like once our printed splints come out of the print, and we do have a number of different materials we can print, and we'll talk you through that today. But I do have a little video here showing the workflows digitally when we utilize that. So there is some background music which I've deleted and muted here so I can talk you through this. Step one is the scan. Preferably, we do accept traditional impressions as well. You'll see here a scan has been arrived at the lab. We import that into our 3Shape design software, outline where we want the splint to be finished, and a basic splint design comes up, which is then manipulated by the technicians here to ensure we get the design right. That STL file is then exported to our CAD team. It is nested where we want the supports to be to ensure they're not encroaching on any of the occlusal surface or the intaglio surface. And that print is then nested, ready for the printing of the splint. The carbon machines are loaded depending on the material required. And you'll see this is the print coming out of the printing machine, ready to be processed. They're removed from the platform, and any of the post-processing of salt liquids are removed, and they are final cured in a light curing process. Once that light curing process or post-processing technique has been finished, comes back into the lab to be hand finished, and they are hand polished by our technicians here in Australia and New Zealand. All splints in Australia, for Australia, are made in Australia, and all splints for New Zealand are made in our New Zealand laboratory. There's the final splint that has been completed. That gets shipped out to the clinician and hopefully do the patient wonders. So the carbon DLS accuracy, I'd like to just spend a moment talking about how great these printers are. The general accuracy is described as a constant offset plus a ratio, for example, plus or minus 65 microns, plus 1 micron per millimeter dimension size. So there is a minor difference of only 1/1000th of a millimeter. And that's what we call the general accuracy. And that's what we could expect to find when we first print any geometry or when we first print a splint. They can be fine-tuned, and we can improve the accuracy of those if we reproduce that splint by dialing the settings, and we can get these accuracies down to 35 microns. But only if we reproduce the splint. But in general, we will only be printing the splint once, so we do focus on the general accuracy. And I do love the fact that it's 65 microns. That's a pretty accurate printer, and we get a pretty accurate result. No more shrinkage during processing. What we print is what we design is what we print. And I really love the accuracy that the DLS carbon printers provide at 65 1/1000th of a millimeter. I'm totally in love with the accuracy of these things. And if they're designed well, they should snap straight into your patient's mouth. There's a few nuances with designing, engaging in desirable undercuts, engaging in labial embrasures, incisal embrasures, but Our technicians are doing all the design, so we're hoping to get those results. And our growth of our splint department is reflective of the results that we are currently getting. I do get a number of questions as to why we don't mill our splints. There's a lot of benefits to printing that we find far outweigh the benefits of milling. There's enormous amounts of waste with milling, and because we're engaging in a lot of those desirable undercuts, the milling technology, I believe, was a little insufficient or didn't keep up with the benefits that we found from printing. So we print all our splints here at Race. We print all our splints, and we also use thermoforming, but I'll talk you through those now. So our first splint is what we call our high impact splint, or our hard splint. It's mostly beneficial for bruxing, temporomandibular joint dysfunction and headaches. Great for grinding, not so good for clenching because it is a full coverage splint. So the posterior contact, really, we lose the benefits of stopping that patient from clenching. The high impact splint is printed. Great for repositioning or reprograms or deprogrammers, depending on what you'd like to call those. But most of our deprogrammers are made using our high impact splint. Outstanding biocompatibility, extremely strong, and this is probably one of our, if not strongest, splints. It is rigid, so really good for a Michigan type splint and deprogramming splints. As I mentioned, it's posterior full coverage, so great for that Michigan setup and grinding, not so good for clenching. It's easy to polish, so if you do make some adjustments chair side, very easy to polish. Extremely easy to clean, and I think this is one of the major benefits of our printed splints over traditionally manufactured or heat cured splints. Not only do they fit better because there's no shrinkage during the heat processing, the heat post processing, but they're really easy to clean. Some of the traditional acrylic splints that we used to make, after a month or so in the mouth, or a month or two in the mouth, you get a real film of plaque forming and they would discolor a little bit. We don't see that with the printed splints. So again, I really believe the printed splints for biocompatibility and cleansing are really second to none. Abrasion resistance as well. This is a high impact splint, hence where it gets its name. Really good for abrasion. So all splints wear over time, but our high impact splint definitely shows the best reduction in attrition over time. So yep, great splint. We are currently using the Key Splint hard material. It does have a slight blue tinge to it, which you can see down here on the splint. It has a little light blue tint to it, so a little bit easier to find for the patient when they're not wearing the splint. But yeah, fantastic splint, great splint for attrition. We'll move across now to our comfort splint. Now, comfort splint is another printed splint, great for minor bruxism, headaches, temporomandibular TMJ or temporomandibular joint dysfunction, and grinding. Again, it's a full coverage splint, so probably not best for clenching. We'll talk about which would be best for clenching in a moment. As I mentioned, it's a printed splint. It is slightly flexible, and these splints, if they're designed very thin and warmed up or warmed up to the body temperature or around up to an inclusive 33 degrees, they do show some flex, and they can flex a little bit. So we call this a medium splint. It's not hard, it's not soft, it really is right in the middle. And again, being a printed splint, outstanding biocompatibility. They are super strong and real easy to polish. So again, if there's some minor adjustments required chair side in the clinic, they're really easy to polish. Easily cleaned. Again, they don't have that film that form on the traditionally manufactured acrylic splints, that film that forms on the in the patient's mouth. We don't see them discolor over time. They're a little bit more easily worn by patients, being a little bit softer. There's a little bit more give. So where the hard splints are intolerated for some patients, these medium splint could be a perfect answer or something in between. It is full coverage, posterior coverage, so not good for clenching, but awesome for that Michigan setup. They're easily fitted by clinicians because they're a little bit softer as well. They're thermosensitive, so in the mouth, they actually, when they come up and to body temperature or up to a maximum of 33 degrees or more, they actually soften a little bit, and that's where they get their name as the comfort splint. So this is our most popular splint, or our most requested splint. So for any of you that are not sure which splint to deliver, I think this is a real good one. It's comfortable, and it does its job as a hard splint, but a little bit more comfortable in the mouth, being a medium splint. So yeah, very popular, most popular splint we make here. We're currently using the Key Splint soft material, and it does have a little bit of a purpley hue, but not as dark as the hard splint, and it doesn't. It has a little bit of a softer finish to it, and so you can tell the difference between the hard and the soft. The hard's a little bit more blue. The comfort is a little bit more clearer. So we're really loving that. Here's a good example of when we design a splint very, very thin and we warm the splint up, we can actually flex it. It does have complete 100% elasticity to it, so it does return to its initial or designed and printed position. Your splint will not be able to do what this photo shows, but it does show the capability of the flexibility of the material. But we don't design our splints this thin, and we don't heat them up this warm, but it does show the flexibility of the medium splint. But as mentioned, it is a 3D printed resin and used to make splints and night guards. Combined with strength, it does protect the teeth with added flexibility and greater patient comfort. The abrasion and fracture resistant and easily cleaned by the patient. And I do love these splints because they are easy to clean. They don't have that film that forms on traditional hard cured acrylic splints. The splint material is an FDA 510K cleared material and it is fully approved, as is all of our splints, by the TGA, and is fully biocompatible and in compliance with all international medical device regulations and standards. So I do love this splint, as do most of our clinicians, and we can see why it's our most requested splint today. So our next splint is what we call our hard soft splint. It is a hard external or opposing surface, and it has a softer insert. It is thermoplastic and thermoformed. Great for bruxing, headaches, TMJ, dysfunction, and grinding. Full coverage posterior, so not the best for clenching, but we see these often requested for restorative protection. Patients had crown and bridge work done or 10 veneers done. This is a very popular splint to protect the restorations. Very comfortable splint because the surface against the teeth is very soft, so the patients do love that. It's also good if the patient does have an intolerance to a hard splint, then this is often a good splint to recommend. Because it's soft in a surface, we do see that it's very easy to fit and very easy to adjust if you are having problems going in, which I doubt you will. Having a soft tooth surface, it is easy to adjust, and being full coverage can be a very comfortable splint. This splint also comes with acrylic, so we call that a hard soft with acrylic. If you have a patient who needs bite ramps or canine guidance, or if you have a patient with an open anterior bite, you might want to request the hard soft with acrylic, and the technicians here will build up the acrylic on top of the hard soft splint to ensure bite ramps, canine guidance, or we do close down and make full coverage for patients that have open anterior bites. Yeah, great splint for that reason. Here's our hard soft mini or anterior mini splint. Great for headaches, bruxism, TMJ dysfunction, and this is the best splint for clenching. If the patient does clench predominantly during the evening or any time of the day, because this is only an anterior splint that goes from 3 to 3, it's fantastic for people. It just deprograms the patient and disallows that posterior clench. So if you have any patients that have clenching issues, you might want to consider a hard soft splint. As I mentioned, it's anterior only from 3 to 3, thermoplastic and thermoform, but it has excellent comfort. One of our most comfortable splints because it doesn't travel across the posterior teeth. It is only in the anterior region, and when that anterior contact takes place, we see full no posterior contact, so the clenching is completely taken away from the patient's capabilities. Yeah, zero gag. So if the patient does have any gag reflex at all, and some people have chronic gag reflex, so being an anterior splint, you might want to wish to promote the hard soft mini or the anterior mini splint to decrease any of the patient's gag reflex. They're easy to adjust because they are soft, and they're usually only worn at night, but they can be worn any time of the day. So again, a fantastic splint and the best splint for clenching. You can see our splint comparison chart here, and this is on our website. And in a moment, I'll show you the QR code that takes you to this. It is a fantastic guide for the people that aren't sure which splint to choose. At first, at the top, it shows the name of the splint: comfort, high impact, hard soft with acrylic, hard soft mini or AMS, our soft splint, clear splint. The strength, you see how strong each splint is. So longevity, or if they are a heavy grinder, you might want to choose a stronger splint. It outlines the benefits of each splint: strength, coverage, biocompatibility, stain resistant, etc. Where the comfort splint is awesome, it's comfortable, it's biocompatible and stain resistant. Hard soft with acrylic, and the anterior mini splint, and you'll see it's great here for clenching. So keep this in mind. The soft splint, which is probably the most comfortable of all splints, but it does wear pretty aggressively, but fantastic for patients that don't grind but have had 10 veneers or more, or up to 10 veneers. This soft splint sits in the mouth. It's basically similar to a mouthguard material, so the attrition will wear the splint down instead of the patient's teeth. And your recommended use down here as well. You can see what each splint is, where the pros and cons to each of those splints. Each of our splints, as you can see down here, do have a 12-month warranty. So if anyone needs to know what the warranties are on each of those splints, you can easily see which splint to use, when and why. I'll just take you to the QR code now, and I'll give everyone a couple of seconds now if they wish to get their smartphone out and QR scan this QR code. This will take you to our website, where our friendly customer support team have kindly uploaded our splint comparison chart to detail the pros and cons of each of our splints. So yes, I quite often get told or asked by patients and clinicians, what's the best way to care for the splint? How should we clean the splint and store the splint? So I'll just spend a quick minute or two talking about that. After they use it, or when they wake up in the morning, they should rinse with cold or warm water, never hot. And I did have one customer say the patient tried to get rid of their that film or build-up of plaque on their splint by burying it in boiling water, and of course the splint doesn't fit. So rinse with cold or warm water, never hot, and store in a deep tissue or even in water. Feel free to drop it in water just to disallow the air to get to it and that plaque build up to form. But ensure you tell your patients that if the splint is not worn for 2 weeks or more, the teeth may move and the splint may not fit. So compliance is imperative for the long-term benefits of that splint. As you know, the teeth are always moving in the periodontal ligaments, so ensure your patients know that they must wear it at least once a week minimum, preferably all the time. If they're going to have a splint, they may as well take advantage of the benefits. But if it's not worn for 2 weeks or more and they don't understand why it doesn't fit, that's why. So really drum home to your patients the importance of complete compliance to maintain the fit of that splint. I did have a person say the splint doesn't fit how they've been through their aligners. Unusual question, but just keep that in mind. If they do go through an alliance program, they will need to, an aligning program, should I say, they'll need to get a new splint made at the end. We do recommend soaking the splint in a material similar to or use Sterident once a week. That can also help in the longevity of the cleanliness of the splint. But the splint will wear over time. All splints do. The softer the splint, the more wear takes place. Our soft splint will wear aggressively, and our medium and hard splints obviously far less. But if the patient does notice the splint wearing, obviously that's part and parcel of splints and what they're trying to do. They are decreasing the patient's attrition, so the fact that the splint wears, not the opposing teeth, is a good thing. So be sure to manage the expectations of those patients. Do encourage your patients as well to take the splint to all of their future dental appointments, and as a clinician you can assess the splint and the wear and keep an eye on what the patient's doing, but also just check the fit of that splint. Make sure that there's no premature contact one side or premature contact anteriorly, and you may wish to just use articulating paper to check that there's full coverage across the occlusal table of the splint. So always encourage your patient to keep it clean, and to take the Splint to all of their future dental appointments. So again, here we've turned what we believe an art to be into a science. We're completely taking advantage of the digital workflow. We're designing all our splints digitally where possible, and our clear splint is not used so much now because the traditional manufacture and shrinkage of traditional acrylics has been proved to be a bit of an issue long term. So yeah, we do really love the capabilities that the digital workflow provided, and we are moved from an art to a science. Remembering that all of your splints will add to your race rewards, and by cross-pollinating your products across different departments at race, you will enhance the compounding growth of your race rewards. So feel free to utilize not only the Splint department, but all departments at race, and you will take advantage of compounding growth of your race rewards. The Race Academy, which we're all watching now, for all of you that don't know, this webinar is being filmed and will be uploaded in the next 24 to 48 hours. So if there's anything else you want to know, or if any of your colleagues wish to know more details, feel free to go to racedental.com.au and go into our education component. Not only can you watch today's webinar, but you can go back and watch all of our webinars, all the past 29 episodes. And yeah, maintain your CPD points. Feel free to go on there. We've got some fantastic speakers, some outstanding subjects. So feel free to go back into the Race Academy program and take advantage of all of the education that our speakers have provided on the webinar program. Our Splint department, if there are any specialist services like orthognathic splints or neuromuscular orthotic devices, implant placement guides, sleep apnea devices, GELBs, GELB appliances, deprogrammers, thumb sucking devices, any specialist services or any unusual request you have, feel free to call me or contact me at matt@racedental.com.au or any of our customer support team here at Race, and let us know what it is you require, and we'll do our best to support you in any specialist requirements that you do have. So yeah, I'm going to throw it over to questions here. We do have a couple. I'm going to, before I do that, I'm just going to stop share here. And I'm going to take you through the difference here. We can see we've got our couple of splints here. And you'll see this is a soft splint. You'll see that it has a little bit of a matte finish, excuse the pun. It's a little bit softer. It's not quite as blue as the hard splint. You'll see the hard splint does have a shinier finish because it is hard. But you can see the how beautiful these splints come out of the printer, and once they've been finished, this matte finish is the medium splint or our comfort splint, and this shinier blue one or little slightly bluish hue splint is the hard splint. So yeah, this is the one that most people request, and our most requested splint. These two here, got a couple more to show. We've got our hard soft splint. You can see it's a thermoformed splint with a hard outer surface and a softer surface against the teeth. And if you do require some ramps or canine guidance, here's a hard soft with acrylic. You can see the acrylic built up on top there. It does enable the patient with open anterior bites to have full coverage all around. So there's our four most popular splints. Just running back now that this patient comfort splint is our most requested splint. So yeah, we're seeing that it's outselling all the others put together. So that takes us to some questions. Let me see what we got here. Any risk of over eruption on posterior teeth with the mini hard soft splint? Is there a maximum time you would recommend for wearing the splint to reduce risk of over eruption? Great question. Thank you, Anissa. Look, over eruption is a problem. If you do have an anterior mini splint and it's worn overnight or even for the day, over eruption tends to only be a problem. It does take some time for over eruption to start, but I think you've got plenty of even days. So obviously they're going to take the splint out to eat, and any over eruption will be combated by the occlusal function or interdigitation whilst masticating of that while they're eating. So I don't think over eruption would be a problem. Obviously, they'll be taking it out to eat. So great question. I don't think it's a problem for splint wearing unless something's kept in the mouth that doesn't have full coverage. As you mentioned, the anterior splint would be more problematic, but yeah, definitely no problem with over eruption because they're taking it out to eat, and all of those periodontal ligament stimulation would take place during mastication. Another question here, can someone send the price list to me? I'm sure I'll get someone here to do that for you, no problems at all. We do have a price list on our Splints. It's pretty easy to read. I'll get customer support to send it out to you. I do have your email address here. Thank you. Next question, and the last question we've got here is, do you recommend the Splint to be stored in a damp tissue during the day, every day? Yes, I do, and it is a good question. I think it is, the damp tissue will disallow the air to get to it, but I'd even recommend dropping it in water. It's the air getting to the Splint that causes that build-up of plaque and discoloration. So drop it in water, obviously not hot water, but just general tap water is the best way forward. Wrapping it in a damp tissue will be better than leaving it on the bench, but disallow the air to get to it. And Faye, that's an excellent question, but I think it's probably best left in water or fully dried. If you don't have the access to water or damp tissue, just try and dry it out. But yeah, definitely scrub it with even warm or cold soapy water to cleanse it, and wrap it in a damp tissue. I think would be a great outcome. Well, I believe I've got some customers that recommend best results are from dropping the Splint in water. We've got some other requests for price list. We will definitely get onto that. And I do appreciate everyone joining us today. I was surprised to see how many people we got with this. Obviously, Splints are a little bit difficult to know which ones to use and why. And I hope today has helped clear up some of those questions around which Splint to use and why. So just to recap, the Comfort Splint is fantastic. It's a medium hard Splint, great for bruxing, TMJ dysfunction, headaches, not so good for clenching. The hard Splint, great for the Michigan setup and someone who is bruxing aggressively and you need a harder surface, predominantly worn on the maxilla. The soft Splint is the best for protecting veneers or full mouth of veneers, so feel free to use the soft Splint, but if they do grind in any way, shape or form, that soft Splint will wear away pretty aggressively, so you might wish to move to the hard soft. Hard soft Splints are great for people that have troubles wearing it, or if you do have patients with teeth that are aggressively flared or have a lot of diastemas in their teeth, or large labial embrasures and buccal embrasures, and the desirable undercuts are very aggressive. Some of the printed Splints are a little bit more difficult to get in, so you may wish to go for a hard soft for patients with aggressively protruded or flared teeth. Anterior mini Splint or the hard soft mini, definitely best for clenching because it disallows those posterior teeth to come into contact. So yeah, I hope that sums it up. Thank you for joining us today. Join us next week, or next month, should I say, for episode 31. We have managed to secure some outstanding speakers. I'm looking forward to introducing those again. We've got some great topics around Professor Stubbs and some great orthodontic topics coming up. So feel free to join us then. I do appreciate everyone. These people that have requested price lists that have come in. Please, Faye, could you please provide us with your email address and I'll get that sent out. But again, thank you all for joining us. I do appreciate your time and look forward to seeing you all for episode 31. Thank you very much from Race Dental Webinar Series. Have a good day.